Welcome to Psych Talk. I'm your host, Dr. Jessica Rabin, a licensed clinical psychologist. If you are a mental health professional, student in the social science field, or just interested in psychology and mental health, this podcast is for you. Although topics discussed on this podcast are similar to therapy, Psych Talk is not a replacement for therapy and is for educational and entertainment purposes only. So let's dive into today's episode. Hey everyone, welcome back to Psych Talk, and thank you so much for joining me for today's episode. Today I have a very special guest with me, Dr. Lesley Kirkpatrick, who is a board-certified psychiatrist, the owner of LBK Psychiatry, and the founder of mindcomb app. So thank you, Lesley, for being here today.
Thank you for having me. I really appreciate it.
I am so excited for our conversation today, but before we jump into that, can you introduce yourself, a little bit about your background and what you do?
Yeah, perfect. So, as you mentioned, I'm Dr. Lesley Kirkpatrick. You can call me Lesley, of course. I'm a general adult psychiatrist based in Halifax, Nova Scotia, so in Canada. I specialize in psychiatric consultations for adults, so 18 years and older, and for all major mental health disorders. I pretty much see everything in an outpatient setting, so that's not acute. And in addition to the consultations, I also run a group therapy session for patients called acceptance and commitment therapy. And this is called ACT for short. And it helps individuals build psychological flexibility and align their actions to their values. So it's a really important modality of therapy and one I'm really interested in. And in addition to my private practice, I'm also the founder and CEO of mindcomb, a mental health app that supports mental health across the full continuum. So, from wellness to fitness to illness and everything in between. And the app combines like clinical informed psychoeducation with original soundscapes. So, the Mindcomb owns the music on the app to really guide emotion and reflection. So, yeah, essentially, I'm a psychiatrist in private practice and I own an app called Mindcomb.
I love it. And we're going to be talking about all of those things
Perfect.
today.
Yeah.
So, first, I wanted to ask you if you would be willing to talk a little bit about your journey into psychiatry. And then I know you said you really see everything, but I know some of your specialties are OCD, burnout, and exactly what you just mentioned, acceptance and commitment therapy. So, how did you come to specialize or really be passionate about, have an interest in those things?
Yeah, yeah, absolutely. So I guess in first, just even going into psychiatry, and I get asked that question a lot because I'm sure you do as also as a
Mhm.
psychologist. Very common
Absolutely.
question. But I really think my answer comes down to as a little girl, like when I was young, I was really drawn to stories. So I was always reading, I was always watching movies, and listening to anybody who would tell me a story. And then during the summer months, I worked at my father's family physician practice. And so I would watch him and help, him put patients into the rooms where he would do his assessments. And I kind of looked up to him and I wanted to be a doctor as well. So when I discovered psychiatry, which probably didn't happen that I even knew it was an area of medicine until probably early 20s or even late teens, I guess. I felt like it was like the perfect intersection between my interests of like human stories and the
Hmm.
science
I
that
love
is
it.
medicine. Yeah. So over the years, I've trained in like multiple modalities of therapy, like cognitive behavioral therapy, intensive short-term dynamic psychodynamic therapy, so ISTDP, but really it was ACT, which is acceptance and commitment therapy, that really resonated the most with me.
Hmm.
So I really incorporated that other than the psychiatric assessments that I do. That's the other part of my private practice. And it really aligns with like being in alignment with your values, which you brought up burnout as another interest of mine.
Yep.
Um, and that kind of really ties well with acceptance and commitment therapy because burnout really is just a misalignment, not just, but solely a misalignment. Um,
Hmm.
and we can talk about that further, of course, if you want to. But so it really is very act focused, I find,
Yeah,
in getting the alignment back together. And then
absolutely.
just to keep going, I think you asked the question also about obsessive compulsive disorder, so OCD. So yes, OCD, I wouldn't say I see more of it than, other psychiatric disorders, but it definitely is an interest of mine, and that is because it's deeply personal because I live with OCD myself. And often, as you probably know through yourself or with patients, what is a really difficult time for you often becomes your purpose, right?
Hmm.
And so, yeah, I live with OCD, so I find it very interesting, but I also find that I have the ability to pick it up when maybe it's a little bit more subtle. And I think that is truly because of my lived experience.
Yeah.
Yeah.
Thank you so much for sharing. And I
Yeah.
definitely want to dive into all of those things, OCD, burnout, act, as we continue to talk about it. But going off of the last thing you just
Yeah.
said, you live with OCD. Um, I was wondering if you would mind sharing a little bit, as much as you're comfortable,
Yeah.
about your personal journey with OCD and how that lived experience has helped you with your clients who also
Yeah.
present with OCD.
Absolutely. So I was diagnosed with OCD in my mid to late 20s. So I'm trying to do the math here. It was right at the end of my first undergrad degree. So
Okay.
what's that, 22-ish? I think
Yep.
it was
22. Yeah.
22. Yeah. But looking back, I mean, I had symptoms dating back till I was a child.
Hmm.
And it did cause functional impairment during my childhood, but it became debilitating during my 20s, which is actually common for a
Hmm.
lot of mental illness to really take off, for lack of a better word, in the 20s. Of course, there can be symptoms as a child too, but 20s is as you know, is a prime time for
Absolutely.
mental illness
Yeah.
to start, or at least become debilitating. And so at the time, I wasn't in medical school. I knew I wanted to be a psychiatrist, but really didn't know much about mental illness. And what I was experiencing, which was intrusive thoughts, I personally didn't have the compulsions that were very visible by
Hmm.
other people. I had mental compulsions, but not, visible compulsions, so no one noticed. Um,
Hmm.
and I did not know it was illness. I actually had a lot of shame and guilt about the symptoms that I had. And so I didn't reach out for help for a while until I had to be honest with you.
Hmm.
There was no other option. I couldn't keep up with school. I couldn't keep up socially. It was just, and at home, it was just really, really difficult for me. So I went to a family physician at the time, who is not my family physician now. It was more of like a walk-in clinic.
Hmm.
Um, and I was kind of not sharing the full story, to be honest with you, because I had a lot of shame and guilt around the
Hmm.
thoughts that I was experiencing. However, like and other people that maybe listen know that a lot of or some of the psychiatric disorders are treated with the same type of medication, which are antidepressants.
Yep.
So I did get treated correctly in regards to the medication worked. Um, but that was not because it was actually treating what I was open about.
Yeah.
But I did get symptom improvement. And so it was a really, really hard experience for me. Um, and it is really one of the two main reasons why I created mindcomb, because
Hmm.
I really had these voice notes in my phone and written journal entries, even though I didn't call it journaling at the time, it just notes to self. And
Yeah.
my OCD was very episodic and still is, meaning I get a big break from it. And
Okay.
yeah, it's not chronic for me.
Hmm.
Um, because of treatment. I'm sure it would be
Yeah.
chronic if I wasn't treated. Um, and so when I am well, I used to write myself and do voice notes when things were better. And
Yeah.
that's kind of what I wanted to create with Mindcomb, that I was so alone and I really could have used the app. And so I created it for other people.
I love that. Thank you so
Yeah.
much for sharing. And I think, you mentioned shame
Yeah.
a couple of times
Yeah.
while talking about it. And I don't specialize in OCD, and I have seen clients who have OCD.
Mhm.
And that's a common theme that I have heard from many individuals, the shame around their intrusive thoughts.
Yeah.
And we'll get into this here shortly about like what OCD actually is, but I did want to highlight that because I think that's such a common experience that people don't feel like they can be truly open because
Yeah.
the intrusive thoughts that they're having are ego dystonic, so not aligned with the person
Exactly.
they are, and therefore that causes shame, whether that be harm thoughts, sexual thoughts, whatever the
Yeah.
thoughts are. And to your point as well, you shared that your compulsions were primarily mental, so people didn't see. So it sounds like you were really struggling internally because there was nobody to be like, hey, Lesley, like, I noticed you're doing X, Y, or Z,
Yeah.
or I noticed you're checking a lot, or
Yeah.
you're engaging in these certain behaviors. Because a lot of times, other people may notice things are different
Yeah.
about us, and if they're comfortable enough, will bring it up to us. But with
Yeah.
internalized compulsions, nobody's
No
seeing
one knew.
what you're,
No.
yeah, experiencing.
No. And then because of the content of the thoughts I was having, they are the ones that do or did result in a lot of shame and a lot of isolation, really. And yeah, I didn't even know it was an illness. I
Hmm.
thought I was a problem, potentially, and I could be or something. And that isn't the case. It can be treated. And it is ego dystonic, yeah, just like you mentioned, like it really doesn't fit well with your moral compass, hence why it's so distressing,
Hmm.
right? Yeah, and it's very difficult. And yeah, when people see the compulsions, they can maybe reach out to you, seek help for you, offer you resources, but the mental compulsions get often missed.
Hmm.
Yeah.
Yeah, well, and I imagine that you having that lived experience or knowing, to even look for mental compulsions can be really helpful, or
Hmm.
ask about mental compulsions can be
Hmm.
really helpful with your clients, or,
Hmm.
even assessing the shame
Yeah.
piece that maybe somebody who, one, has not had lived experience, or two, isn't an expert in OCD may
Yeah.
miss if they're just
Yeah.
like looking at the ICD-10 DSM
Yeah,
criteria.
exactly. Exactly. And it really has changed my practice, having not changed it, I guess, informed it because I had
Hmm.
OCD before I even became a doctor. But I asked very open-ended questions for a lot of the disorders, and of course let, patients come up with why they're presenting complaint or what their difficulties are. But for OCD, I just put it right on the table. I go through them
Hmm.
all because I think it's actually a lot easier, and I would have found it a lot easier to be like, yes, I have that, instead of to
Hmm.
bring it up at first, thinking that the doctor in front of you would be nervous of those thoughts or judging those
Yeah.
thoughts, which is not the case, but the patient wouldn't know that or the client wouldn't know that, right? So I just put them all on the table. I'm like, and I think it's really helped and really helped me pick up some cases that I think would have gone missed.
Yeah. No, I
Yeah.
think, the direct asking of questions. I also ask a lot of open-ended
Hmm.
questions, but I have found for the more difficult topics, whether that be, suicide, self-harm,
Yeah.
trauma,
Yeah.
um, harm thoughts, like homicidal thoughts, uh, sexual topics in nature, asking directly
Yeah.
oftentimes will get a more honest answer, in the sense of like, oh, okay, this person sitting across from me actually wants to know. If they're bringing it
Yeah.
up, they're not going to feel embarrassed or shame about it. So I shouldn't, versus just being like, anything you want to bring up today? You know, the
And the
client's
answer would
like,
probably be like, no,
absolutely no. Or like, I
not
don't even know
here.
what to say. Like,
Yeah,
but no, I'm
exactly.
absolutely not bringing up
Yeah.
my thoughts, or
Yeah.
they didn't even ask about this. So maybe I am really, like,
Yeah.
something is really wrong with me.
Really wrong and no one can know,
Yeah.
right? Or they have never seen anything like this before. That is a
Hmm.
very common thought, and I held that thought.
Yeah.
Whereas like they have never seen this. And so there's
Hmm.
no way I'm telling this doctor that. And now I see it
Hmm.
often. But
Absolutely.
yeah, but I didn't know that. And I know that there's people that would be at home thinking very similar thoughts that I had. Not just the intrusive thoughts, but actually the thoughts that they're different. There's no way that this is treatable or an illness, and that the doctor has ever heard this before, or the
Hmm.
the clinician of some sort. Yeah. So I
Yeah.
think it's really important, just like you said, just put it out on the table for definitely around specific things, and suicide and self-harm and
Hmm.
homicidal thoughts are also ones that I would do as well.
Absolutely.
Yeah.
So we're talking about OCD, and on this podcast, I always love for my guests to define what we're actually talking about,
Oh yeah.
because,
Yeah,
people might
absolutely.
have an idea
Yeah.
of what OCD is, but
Yeah.
maybe they don't actually know. So, can you define for listeners
Yeah.
what OCD is? And then the second part of my question is, can you share maybe some more subtle signs that uh, people may miss when it
Yeah.
comes to OCD? Thinking about the mental compulsions that you were sharing, suffering
Mm.
alone, I think that would be interesting to hear as well.
Yeah, absolutely. So I think, in my personal opinion, OCD is one of the most trivialized psychiatric disorders, and could be potentially one of, not maybe, not to put them on a spectrum of competition, but like it's quite debilitating. And,
Absolutely.
there's a stigma language around it being like, I have my OCD, or that's
Hmm.
my OCD, as something that's very almost aspiring, to have. It
Mhm.
means like, your house in your closet all looks great and so does your kitchen. I don't know.
Yeah.
And so, which is really not the case. And when you hear those words, it might seem like it's just um, very innocent, but it's really not for someone who's really dealt with a lot because of it. So, obsessive compulsive disorder, OCD for short, is a psychiatric disorder. And it's characterized both by the presence of obsessions or compulsions or both.
Mhm.
And so a lot of people think that you have to have the obsessions and the compulsions, but you can have one or the other or both. And
Mhm.
so obsessions are recurrent, intrusive, unwanted, and that's when we use the term like the dystonic or ego-dystonic thoughts, urges or images. So it also can be like an urge or an image,
Mhm.
mental image, not a hallucination, but an image that can cause very much like significant anxiety or distress. And then individuals who experience those thoughts, intrusive thoughts, urges, or images, will then attempt to ignore or suppress the thoughts or images or neutralize them with a compulsion, hence why you can have compulsions as well.
Mhm.
And so compulsions are repetitive behaviors that people might know of like the hand washing, the checking, like checking the stove, checking the doors, rearranging, counting, but they also could be mental acts, which I spoke about a little earlier, which could be praying or repeating words silently. And they're often driven to perform in response to an obsession or to a self-imposed, like rigid rule. Like it must be the way. And then they're, also intended to decrease anxiety and distress. And OCD symptoms, whether it's the obsessions or compulsions or both, are very time consuming, often greater than an hour per day. And an hour could even be quite minimum for a lot of people,
Mhm.
and cause significant impairment in daily function. So it's if you could live with that and it's like, doesn't affect my home, doesn't affect my life, doesn't affect my work, which I never see, but let's just pretend that could happen, then is it really truly a disorder? I think it's just a bunch of symptoms. But the it's distorted when it becomes functionally impairing, and I can only say that I've only ever seen it be so. Yeah,
Mhm.
yeah,
Absolutely. Thank
yeah.
you for describing that because I think one of the first things you highlighted was obsessions or compulsions or both.
Mhm.
And that is a common misconception I hear is that people think you have to have
Mhm.
both. Or, and I know you've already talked about this and we've highlighted it, that the compulsions are always observable by
Exactly.
others.
Yeah, and I didn't answer the second part of your question, but I just got reminded of it is I think the question was that like what could be more subtle, the subtle signs
Yeah,
of
the subtle signs. Yeah.
yeah. And I think the very visible rituals are less subtle and people bring up to them, like the hand
Hmm.
washing, the checking. But the subtle ones, I think a lot of people might not even know it's OCD is the praying where they're not
Hmm.
truly like a religious person or don't identify with a religion, but a lot of praying and a lot of if I don't do this, whatever the action or mental action might be, then something bad will happen
Hmm.
to another person that is not related. And
Yeah.
meaning not related to you. I mean, like if I don't say this prayer, then something bad will happen to my mom,
Yeah.
right? The prayer is not going to keep your mom safe, right?
Hmm.
Potentially. You know what I mean? Like it's just very much, I don't know if that was a great example, but um mental acts that are not connected to what you're trying to prevent from happening. That's a better way to
Hmm.
say it. Another subtle sign of OCD, driving with OCD. So, a lot of people who drive and that have this type of a form of OCD, they'll think that they've hit someone on the road or in a sidewalk and then just keep driving and then start doing circles back and going back to the place. No one was hit, no one might have even been there. But there's a fear that they caused significant harm and really dote. Dote is such a key
Hmm.
of OCD. It's
Yeah.
the dote, did I? Right?
Yeah.
And even when there is insight, so sometimes OCD comes with insight and sometimes it doesn't. When there's insight, I say there was someone they saw later in the day, they're like, no, I know I didn't hit them in the crosswalk, but there can still be that element of doubt where it's impairing. And then they might go
Hmm.
back to the place and check and ask around. So that's a very subtle one that I see. And then of course there's the violent and the sexual ego-dystonic intrusive thoughts
Hmm.
that are very distressing for people. And I think a lot of people think in general, not just with OCD, if you think it, it must be true.
Yep. Oh,
right? For
absolutely.
anything, even if
Mhm.
it's an anxiety disorder, whatever it may be, or just even a general thought. And, you can think things. A lot of people have intrusive thoughts and they just kind of like leave and they go on. But I would say like OCD, it's almost like the thoughts on a conveyor belt. It
Mhm.
doesn't stop and it just keeps going over and over like in a loop. And the more you pertain to it, the more you try to dissect it, the more you try to, the worse it gets, right?
Yeah.
Yeah. And so it's about really, I'm kind of just ranting now, but I guess I could
No.
talk about this all day.
No, I appreciate it. I really liked or the driving example because I've
Yeah.
done a few episodes on OCD and nobody's ever brought up that as an example. I
Yeah.
have had people guests come on talk about how it is like a doubt
Yeah.
disorder.
Yeah.
But I think the driving example you gave really highlights that doubt and like, okay, we can have evidence that this is not true. And
Totally.
my OCD is like saying, well, what if you did?
Yeah.
Even though the person is clearly
Yeah.
fine, or you
Yeah.
are talking to them, whatever it is.
Absolutely. And people don't know or patients, clients don't know that that's OCD. So that's one of those examples, although it's less difficult potentially to bring up than a violent or an intrusive sexual thought.
Hmm.
They look at me almost like, huh, how did you know that?
Yeah.
When I bring that up, they're like, I can't drive anymore because of that's, they don't even call it a symptom because they don't think it's a symptom. They think it's
Hmm.
them, right? So it is a good one to catch because the validation, the real thing with OCD is there's lots of treatments for it, and we can get into that if you want to, but the validation with OCD, I think all mental illness, once you've been validated that this is an illness and this is not you, this isn't symptoms, a cluster of symptoms that are impairing you.
Hmm.
I think especially with OCD, it can be quite relieving, almost like that is part of the treatment
Hmm.
package or part of it, right? Because it's
Yeah.
such, oh my goodness, I've been living with this guilt and shame and fear and doubt, and this is treatable.
Yeah.
It's wild, right? Like it's actually quite sad because people live with this for a lot of their life, if not all their life, without getting help.
Hmm. Or without knowing, like you said, that they can get
Yeah,
help because going back to one of the first things that you shared
yeah,
with regard to your personal experiences, you thought it was you. Like many
totally.
people, I mean, I hear that a lot with especially the more like sexual intrusive
Yeah,
thoughts, like I'm a horrible person, I'm a monster, like,
yeah,
and I guess I don't know if this is a more subtle sign, but the avoidance of, well, I'm not gonna allow myself to be around children because I have these horrible intrusive
yeah.
sexual thoughts, or I'm gonna avoid, you know, my partner or whatever it
Yeah, the
is, the
avoidance
avoidance.
is huge, right? And it's not truly like a symptom, but I think it's as a result of it, where
Mhm.
people won't go and have relationships with their nieces or nephews or their friends' kids, won't have children, or won't, for the violent thoughts, won't cook,
Yep.
right? Won't,
Because of knives and yep. Mhm.
yeah, won't do other things. And that can really change your life in a lot of ways, not even just living with the guilt and the shame, but just even that it changes the direction of your life, whether it's to have children, whether it's to have relationships with children in your life. And I think the core of OCD, and I don't really know what the research on this is right now, but the core of it is like, I'm bad, like
Mhm.
I'm wrong, especially with those intrusive thoughts. And it's just so sad, right? Like it's so
Mhm.
sad.
Absolutely.
Yeah.
Yeah. So you just mentioned that treatment is available, and
Oh, yeah.
feel free to talk about all the treatments. I specifically, if you're willing, am interested in how ACT, because you specialize
Yeah.
in ACT, can be
Yeah.
beneficial for individuals with OCD, but also feel free to touch on other treatment modalities as well if you would like to.
Yeah, absolutely. So there's two like main streams for a lot of psychiatric illnesses, which is the psychotropic medications and the therapy.
Hmm.
And so for the medications, antidepressants are the mainstay treatment for OCD, whether it be SSRIs or not all antidepressants are indicated, and I think both the US and the Canadian guidelines would be a little bit different. So I won't name specifically which ones, just because
Yeah.
I think it does vary by country to country which ones are approved. But typically, antidepressants, not all, but can help with OCD. Often, OCD and anxiety disorders in general typically need higher dosing of
Hmm.
antidepressants as well to really help. And then sometimes that isn't sufficient, and there's augmenting therapy. So augmentation, which means you can add another type of medication to the antidepressant to really help with the symptoms. But therapy is also really important. And for mild OCD, it can be sufficient without the
Mhm.
psychotropic medications. And the mainstay gold standard, we call it, is exposure and response prevention. However, acceptance and commitment therapy also does have um, evidence for being helpful for OCD. And I remember I just said something earlier, like focusing on the thoughts, the intrusive thoughts, can actually, help the loop keep going.
Mhm.
Um, and really wiring like neuroplasticity, right? It just keeps it going. Where ACT is really, you can live with thoughts or live with whatever thoughts, whether it be an obsession or any kind of thought, and still live a very value-based life, which is one of the areas of ACT with committed action, which is very goal-focused, and it
Mhm.
really, really promotes psychological flexibility.
Mhm.
So and acceptance, hence acceptance and commitment therapy, that you can live with obsessions and still two things can be true, right? You don't have
Mhm.
to go and really fight the thoughts, right? You can just
Yeah.
live with them and still live a value-based committed action acceptance life. Yeah.
Yeah. No, I love that. And I know, exposure with response prevention is considered the gold standard. And I
Yeah.
know there's some emerging evidence on inference-based cognitive behavioral therapy, at least
Hmm.
in the US. But at least, and like I said, I do not specialize in OCD, but I have found like the thought diffusion aspect of
Yeah.
ACT to be
Yeah.
very helpful compared to like traditional CBT, for example, where you're supposed to like challenge and change your
Yeah.
thoughts, like exactly like you said, that makes you focus on the thought and then it reinforces the thought versus exactly like you said, well, you didn't say the word coexisting. That's how I kind of conceptualize it, like
Yeah.
coexisting with the thoughts, but living that value oriented
Yeah,
life.
absolutely. And it's almost like both have evidence for it. And yes, of course,
Mhm.
exposure and response prevention is the gold standard and has shown to be, quite effective. But for those who might not know, like, it's really, yeah, analyzing the thoughts of what's the evidence for them, really almost, cognitive based
Mhm.
approach, where acceptance and commitment therapy is the diffusion of the thought. Like, you're a thought, you're coming along for the ride.
Mhm.
Not going to play any much part in it. And as a result, I'm going to go live a life aligned with who I want to be.
Mhm. Yeah.
And so, yeah, I think it's great that there's other ways and other types of therapy that could be helpful for different people.
Mhm. Well, and going back to a couple things you said with, kind of struggling with it alone, how it is extremely debilitating. You gave a number of examples of like not being able to cook, not having relationships with certain people, not driving. With ACT, when you so much focus is on your values and having a value-based life, like if you love cooking, but
Yeah.
your OCD prevents you from cooking because you're scared to pick up a knife because your OCD tells you you're going to harm yourself or someone else with it, I'm assuming ACT can help you create those goal oriented steps to align with your values while simultaneously like combating OCD by
Yeah,
the thought
absolutely.
diffusion
And
aspect.
absolutely. And that's a great example in a few ways. One, because if cooking is such a, and what cooking brings to your life is such of high value to you, then that's going to be a real big loss. And you've already
Hmm.
lost a lot with having OCD, right? The feeling of that.
Absolutely.
And then I think it's also your therapist could look at what is it about cooking? Is it creativity?
Hmm.
Is it like what is it about that cooking you love? And can you find this, not saying not cooking, but can you find this in other ways too?
Absolutely.
Yeah.
Yeah. I
Yeah.
love that. I love that. So, kind of switching gears
Yeah.
to another area of expertise that you focus on, burnout. You mentioned that at the
Mhm.
beginning. So, I feel like burnout has become such a buzzword. I know you also said like OCD has become like, oh, I'm so
Yeah, they
OCD or
both kind of
things. I
are,
know.
but
Yeah, I should have. We could have had a whole episode of just on like
I don't
the
know if I made that connection before.
buzzword.
I mean, I knew
I
that as both, but I didn't know that I find both very quite interesting that they're both used so prevalently, like just all the time.
Yeah, I
Yeah.
didn't make that connection until I was literally asking you this question. But can you, because of that, can you define for listeners what burnout actually is, not
Yeah,
what
absolutely.
social
So it's
media
not a
tells us?
psychiatric disorder. It can lead to a psychiatric disorder potentially, but it's a syndrome made up of three
Hmm.
components. So the first one is emotional exhaustion. This doesn't mean you can't be physically exhausted as well, but emotional exhaustion really kind of extends beyond physical tiredness. So it's being drained, being detached, or feeling detached, I should say, and really just not able to give your full self into
Mm-hmm.
your work, which is
Yeah.
not the only area of burnout, but definitely one of the main areas of burnout which people refer to. But I guess you can be burnt out in a lot of different ways. But
Mm-hmm.
people often refer and use that interchangeably with work. The second part is mental distancing. So what that means is it's being very like irritable,
Mm-hmm.
cynical, um, detached from the job, if we're going to use
Yeah.
job as the example. And the third part of the syndrome is reduced professional efficacy for work specifically. So, efficacy in general. So, just not as effective as you once
Yeah.
were. And so, burnout is not a psychiatric disorder, it is a syndrome. I think it's becoming more common. And I do also think it's the word burnout is really also being interchangeably used with like just feeling tired or just needing a break, and that's not
Mm-hmm.
always the case, right? Also, you can have a lot of work and a lot of to-do lists and a lot of things on your plate and not be burnt out. To be honest with you, I work a lot of hours, and I'm sure you
Mm-hmm.
do too, Jessica,
Yeah.
and I'm not
Yeah.
burnt out. And the
Yeah.
reason I'm not burnt out, tired, yes, not burnt, exhausted maybe, but not burnt out because I'm aligned.
Mm-hmm.
And what I mean by that, so that really, my talking about acceptance and commitment therapy earlier, and thanks for asking about that, burnout really falls really, really nicely in that, or working through burnout, because it's a misaligned with values. So someone who might
Yeah.
be misaligned at work, for instance, if we're going to use that example, is because I'm making this up, but maybe the person is really likes flexibility, autonomy in their job, but they're working in a job that's micromanaged and
Mm-hmm.
the opposite of that, right? And so that's
Absolutely.
misalignment. And someone listening might be like, well, doesn't everybody want autonomy and independence and flexibility at their work? No, actually,
Mm-hmm.
not really. There's a lot of people that want to know what to expect, when to leave at 5, what their tasks are. And then there's people
Mm-hmm.
like myself that want to not have that. I want to just don't
Want
want
to
that.
not.
Yeah. I want challenge in my job. I want
Mm-hmm.
to completely challenged. And I give this example to patients sometimes. So a lot of my patients know that I work long hours because they'll sometimes come to evening clinics and they ask me, "Are you burnt out? You must be burnt out." And they love giving me advice, which I actually love as well. You should rest. And I'm like, I'm not burnt out. But I was a lifeguard at a pool that no one came to an entire summer. I'm telling you, I didn't have one swimmer. And I
What?
was, yeah, yeah, I don't know why they paid me to be the lifeguard, but not one swimmer. And I was burnt out.
Mm-hmm.
I was so
Because you were
burnt.
just sitting there, I'm
I
assuming.
was sitting there, and a lot of people would be like, dream job, read and tan and swim all day. And I was so burnt out because I love challenge. I love growth. I love all these things that I didn't get there. So it's not about
Mm-hmm.
long hours, and my hours weren't that long. They were just,
Mm-hmm.
typical hours. I'm working way more hours, but I'm aligned. And so
Mm-hmm.
going back to burnout, it's the misalignment, it's the lack of fit that leads to burnout. So no holiday in the sun, weekend off, mental health day is going to help because it's still misaligned when you return.
Mm-hmm. Yeah. No, I love how you conceptualize that, and I love how you also highlighted it's not just being tired, because I talk to people about burnout. I've had a couple episodes on burnout, and it's the other two components. So like everybody knows, okay, tired, but like the
Yeah.
cynicism that
Hmm.
um you brought up is one I hear like people are like, wait, what? Or like the efficacy,
Yeah.
or they think they're not as efficacious. I had to pause and like think about how to say that word for a second because, oh, I'm tired and that's why. But
Yeah.
hearing you talk about like misalignment, we're not going to be as productive as our at our job if we're misaligned and don't want to do it. Or
Exactly.
even like, and I know we're talking a lot about jobs, but you can be burnt out in other
Friendships
areas
and
of your life
home.
as well.
Totally.
Yeah,
Yeah.
if you don't want to, I'm going to go off friendship. If you don't want to be in a friendship anymore,
Yeah.
yeah, you're not going to be as good of a friend or show up as much because you don't want to be there, but maybe you're too scared to like end the friendship or set boundaries around it.
Exactly.
And it's that misalignment that you brought up. And I don't think I've ever had anybody conceptualize it like that, but I love the way you
Oh, thanks
conceptualize
for
it.
saying that. And yeah, like friendship, that's a whole other I could come and talk about friendship again. I think friendship's also a very, very interesting conversation. And I think a lot of people don't, I think, just side note, I guess, that when breakups happen from a romantic partnership, there's a lot of more empathy and sympathy and support for that, and
Hmm.
not the friendship breakups. And in all fairness, those are relationships that have been sometimes way longer and way more intimate, not in a physical sense,
Absolutely.
but in an emotional sense. But yeah, friendships can also be misaligned, right? Maybe your friends or a friend really values these values and they're not aligned with your values. There's a
Hmm.
misalignment there. That doesn't mean that friend's not a great friend for someone else. It's just no
Absolutely.
longer a fit, or if it's a fit, it might need to be in a less way.
Hmm. Absolutely. So
Yeah.
you also just said a couple moments ago that like no holiday in the sun, no weekend off is going
Yeah,
to fix burnout. So thinking of burnout as a misalignment, can you discuss like some actual
cool.
actionable, tangible steps that people can implement to
Absolutely. So,
actually overcome burnout?
absolutely. Yeah, absolutely. I think the first thing, the most important thing is to find out what you actually value.
Hmm.
And I say this to patients a lot. Like, I do psychiatry and I can't think of values at the top of my head. I'm lucky I can think of 5 words in a day, let alone a list, a list of values. There
Yeah.
is tools out there. Go
Yeah.
to, images online, and look up a list of values. You don't have to recall them out the top of your head, although it might be interesting to see which ones just naturally do come up.
Hmm.
And what someone else values, like Jessica, I'm sure we might be actually similar because we do the, very similar lines of work, but maybe not. It's not about what you think you should value, what your parents think you want you to
Yeah.
value, what your partner wants you to value, what everyone else your age values. It's what do you value, right?
Hmm.
And making a list of that. Then you can finally see where the problem is. You can't communicate anything, I don't believe, unless you know what the issue is at hand.
Yeah. Absolutely.
Right?
I agree.
So it's identifying the values, and then you find out how can you communicate this to a supervisor or a boss or whoever it may be if we're talking about work specifically, or it could be a friend if it's the friendship example. And seeing how can we become more aligned. Does that mean
Hmm.
the business or the company that you work for is going to change their whole structure just to meet your values? Probably not. And some of them might be tolerable to not be met, and some of them it'll be too much,
Yeah.
right? It'll be too much of a cost for you to have that job. And then you can look for other positions within the company or the job, or maybe look at a different options. But your values need to be aligned, or you will be burnt out,
Hmm.
eventually at least. And then I think after communication, it's self-care.
Hmm.
And that's not the holiday in the sun, even though that might also be needed in fun as well.
Yeah.
It's really the basics. And
Yep.
and Jessica, I really think that there's a lot online about all these things you can do for your mental health, but it's the basics that work. And
Hmm.
that's sleep hygiene.
Yep.
That's exercise, moving your body at least 30 minutes a day, 5 days a week, and it's only minimum to modern. Not that I'm doing it very much, but that's what the studies show. Yeah, it's not like go run a marathon every day.
Yeah.
And it's still hard to do. And if you have mental illness, it's more hard to do. And I
Yeah.
think that's a really important point to make
Hmm.
because there's also a lot when, like, I find that really hard to go put that exercise in. And if you're having difficulties with your mental health or physical health, that's more hard to do.
Absolutely.
Yeah, so sleep, physical exercise, community,
Hmm.
very important, right? To have people that get you. It is not about the quantity, it's the quality of those relationships. And that's, self-care and eating well too, a nutritious diet. Those are the things that you can do while you're identifying your values and communicating and how to become more aligned.
Hmm. Yeah. There's so much you said that I love there. I love that you highlighted going, I always say going back to basics on self-care. Because if we're not sleeping well, and I will fully admit I don't get the recommended amount of sleep. If we're not
You're
nourishing our body, if we're not moving our body, a bubble bath with certain scents might be nice,
oh,
but it's
nice. It's not it though.
it's a temporary, whether it's
Totally.
15-30 minutes.
Yeah.
And I always like give this example to people, like, how do you feel after you've taken a shower, maybe after you worked out or were outside sweating, or like maybe couldn't shower for a couple of days for whatever reason? You just feel a lot better because you're clean. And like those are
Yeah.
the things that I feel like we underestimate, those like
Yeah.
basic
It's all
self-care
the basics,
practices.
really.
Which gets to another thing that I was thinking about, which goes with ACT as well, like the values align goals. Yes, the holiday in the sun is wonderful, and it's going to be the small things we're doing each day that are going to help us in the long run, rather than like waiting on that vacation that we're only taking once a year or twice a year.
Yeah. And it's also not fixing the problem at hand if it is actually a misalignment at work,
Oh,
because
absolutely.
you come back to where you were, right?
Hmm.
And so I love that you also talk about the basics because I think, you know, there's a lot more people talking about mental health, and I think that's really awesome and really great. But I think we have to, if we leave the basics, I think we lost the conversation. And sleep, nutrition, exercise, community
Yeah.
are everything, really. I mean, of course, there's disorders that need medication and therapy, but everyone should be doing those things and constantly be working on them. And the other thing is now we have to add in, decreasing digital
Hmm.
um, time, right?
Yep.
On digital items or digital devices. And so that's also really important because you're really numbing when you're doing that and
Hmm.
scrolling, right? You're not
Yeah.
living things like you said. And I should have mentioned, and you did, being out in nature and vitamin D is also
Oh,
super important.
yes. Yep.
Yeah.
Yep.
Yeah.
Oh, once again, this is what I try to do, but don't always get it done. But uh, during work, especially like over lunch, if I'm not doing my notes and doing work and I'm actually taking a lunch break, I try to go outside and
Me-
just like walk, even if it's only like a 10-minute walk.
Yeah.
I try to do longer, but just getting outside and one, you're moving your body, but two, fresh air. We were talking before we hit record, like where you are in Canada, like there's like no sunlight
Yeah.
basically this
Well, there's
time.
definitely a lack with the time change and the months we're going in. Yeah. And I mean, a lot of people are vitamin D deficient here.
Hmm. Yeah, and so taking advantage of the time you can get outside, because otherwise it's like dark,
Yeah.
and
It's
that's
not good, right? And then,
a whole other thing.
and these are things that you can do and you can incorporate in your day, right? And
Hmm.
if it's hard, and I think we all find it very hard to put in even the basics into our life. But maybe it's you
Absolutely.
talk to your family member on the phone while you sit outside on the porch, or maybe, you walk while you take a call. Like try to incorporate and pair, as I call it, um,
Hmm.
the things that are really good for you with things that you probably have to do or should do or need to do for your job or whatever it may be.
Yeah, I
Yeah.
encourage pairing all the time
Yeah.
as well.
Pairing's important.
Yeah,
Yeah. Like I
absolutely.
said to you earlier before we press record, I don't think I've ever done a host tour without listening to a great
Yeah.
podcast. Look, it's just not
Exactly.
going to happen. The dishes are just not going to happen today if I don't listen to this great episode, of some sort.
Exactly.
Yeah.
Exactly.
Yeah.
So, as we are getting towards the end of our conversation, I did want to spend some time talking about mindcomb, because you
Oh,
created this app and you mentioned a little bit at the beginning, but can you tell us a little bit about this mental health app? What
yeah.
inspired you to create it? You kind of gave us a glimpse saying it's like what you needed when you
Yeah.
were going through your OCD, but anything you want to share about it?
Yeah. So I would have loved to have this. I think I would have got help a lot sooner, and dealt with less shame and guilt than I did. But then another reason for creating it is when I'm doing these group therapy sessions, the last few years, patients would always ask me if they could record me. And no was my answer. But
And no.
and no. But I realized, and I had friends and family members and people say to me, like, oh, I saw a therapist. I just can't remember that one thing they said. And that's
Mhm.
very common where
Yep.
people will see therapists, psychiatrists, psychologists, and they took something away, but there was no recording, and they would love to revisit it and
Hmm.
relook at it. And so I was thinking, this could exist outside my office and outside a psychiatric office. And
Hmm.
so the overall mission of it is to decrease stigma, which is something I'm very, very passionate about. And I believe personally that we have so much mental health stigma, or we haven't evolved as much as I wish we have, is because I
Hmm.
think we actually separate the wellness industry from the mental illness too much. It's all mental health. And as
Yeah.
someone who's had mental illness, has mental illness, maybe in remission right now, but it's still, you have mental illness. Um, and I've also been thriving.
Hmm.
and I'm the same person and would love to have the product be in the same facility, right? So I
Yeah.
created mindcomb. It's an audio app across the full mental health continuum. So from mental wellness to all the way to mental illness, and then also mental fitness in the middle, which is, maybe things like burnout, not psychiatric illness, but it's also not thriving. It's you're having a
Yeah.
difficulty. And so they're all about 5 to 10 minute audio clips and they're paired with original music. So I'm working with musicians and we're creating music because music really directs how you feel. So if you're going to watch a
Mm-hmm.
scary movie trailer, the music is going to show you that it's spooky and that it's scary. Not that there's any spooky or scary music on Mindcomb, but music really directs feelings, right? So
Mm-hmm.
motivational kind of music for the wellness, more music that, gives hope for the mental illness section and mental fitness that's really like decreasing feeling overwhelmed. And I want people to know that there's a place for them in Mindcomb. Everyone, and that's really who the app is for. It's for everyone because everyone has mental health.
Mm-hmm.
And yeah, it's support. Support should be available to you when you want it. And so there's also a journaling component to the app. So you can actually journal in the app. Um,
Wonderful.
yeah, or you can do pen to paper if you prefer, because it also has journaling audio prompts. So patients often come up to me like, I want to start journaling. I know the benefits of journaling, but where do I start? And I'm like, I kind of get you. Like,
Mm-hmm.
I'm also not a really great at pen to paper. I need
Mm-hmm.
someone to tell me what to write about personally. So I created all these audios for all the different topics from wellness, fitness, and illness, and guided questions on how to really process your inner world. Because when those emotions and those thoughts stay within, the body catches up both physically and mentally. And so
Mm-hmm.
it's really important to process them and put them out. And so, yeah, it's a mental health support app. Very excited of it, very proud of it, and I really hope that it helps a lot of people.
Yeah. I'm glad you told me it was for everyone because I was definitely going to ask you
Oh yeah.
who's it for. But no,
Yeah.
but that makes sense. If you're looking at the whole like spectrum
Yeah.
continuum, it's not just for people with severe OCD or severe depression.
Absolutely. No.
It's those feeling burned out. It sounds
Yeah.
like those that maybe are doing well with their mental
Really
health
well.
and
Like
then
I
want
do a
to
lot of future self
maintain that.
stuff. I love self-development. It's another
Love
area of
that.
interest of mine. So there's a whole section of like value-based living, acting as if,
Hmm.
purpose, like all that stuff. And I think any product, and it doesn't have to be a mental health product, any product is not for everyone, right?
Yeah.
But
Yeah.
I would say mental health is a content that could be for everybody because if you're human, you have mental health,
Absolutely.
you
Oh,
know?
just like everybody has physical health. Like
Yeah.
that could be a whole nother conversation that I
It's a
know
whole other
we're
discussion, but
getting
like
to the
it's
end.
literally for
But
everyone. Will everyone love it? I think everyone's so different, and I hope everyone does love it. But in regards to who does it apply for, everyone, because
mhm,
if you're a human in this world,
yeah.
not only well, you also
Mhm,
deal with difficult things in regards to your mental health. And then some of us, unfortunately, will have illness. And if you
yeah.
don't have illness, someone who may be listening to this, you know someone that does, and probably know
Yeah.
a lot of people that do.
Absolutely.
Yeah.
I
So
also love how you said that you're working with musicians and composing music. I actually did a recent episode with Dr. Barb Minton talking all about like music and mental health and
oh, it's
how
amazing.
music is or can be
Yep.
so helpful for mental health
Absolutely.
outcomes. Obviously, like you gave the example of like horror movies and stuff like that.
Yeah, I
That's
don't know why
probably
that
not
was my
super
example.
helpful. But yeah,
Yeah.
and like
It
the
directs your
healing.
feelings, right? And it can
Yeah,
actually calm down your nervous system too, right? So,
that's exactly what I was going to say. And the healing power of music, if you
yeah.
listen to certain frequency of music,
Mhm.
certain like I am no
Yeah, they're
musician,
saying it
but
actually changes the delta waves, certain
mhm,
certain beats, right? In your brain. So it's actually a very, very interesting area.
mhm.
It's the
Oh,
music.
absolutely. And then I
Yeah.
feel like going back to basics of self-care, like music is something that most of us have access to
Yeah,
and
very
can
much.
listen to.
Yeah.
So I love that it's also paired with
Yeah.
music as well.
Yeah.
Well, Lesley, I have loved this conversation so much.
Oh,
I
me
feel like we have
too.
covered so much, but I also know there's so much more that we could talk about. But before we wrap up, is there anything I haven't asked you about that you really want to touch on? Maybe something we brought up earlier that you want to revisit? Any last
Yeah, I,
thoughts or
I just
things
want
you
to
want to
thank
say?
you really truly
Yeah.
for having me on. And I love meeting people that do similar work, and whether it be therapists, psychologists, psychiatrists, because like I said to you earlier before we start recording, like we really, I don't want to generalize everyone, but everyone I tend to meet that does this area of work really love what they do. And
Absolutely.
I love talking to people that are also very passionate about it. And I can see that in you, and I love that. So like I could talk to you all day.
Well,
I know
thank
we only
you.
have a certain amount of time, but I want to thank you for having me. And I guess the only thing I wanted to add about Mindcomb, which is that we've been giving some feedback, which has been really great from therapists, from psychologists, from family physicians, that not only do they find helpful for themselves, because they're human, for their clients or patients, but also for like psychoeducation for like themselves, right? So
Yeah.
yeah, because there's a lot of information, whether it be about antidepressants, and there's just a lot of information on it, and so that can be
Oh,
really
awesome.
helpful. Yeah, yeah,
Absolutely. Well, the last question I love to ask all my guests is where can people connect with you? And then, of course, where can people download Mindcomb?
yeah. So you can connect with me at Mind on Instagram, at Mindcomb app, and as well me personally at Dr. Lesley Kirkpatrick. And you can download Mindcomb on the Apple App Store or Google Play. And you also can purchase annual subscription through mindcombapp.com. And I would love to provide your listeners with a discount code um, for that.
I
Um,
love that.
yeah, and so I can give you that. Apple and Google do not accept discount codes and
Of course not.
promos. So if you wanted to use the discount code, you'd have to go and purchase through the website. Otherwise, if you can get it through Apple and Google as well, but not the
Awesome.
discount code. Yeah.
Awesome. Well,
Yeah.
I will link all of that in the show notes of this episode. But thank you once again, Lesley, so much for coming on. I loved our conversation, and the feelings are the same. I could talk to you for hours. For the listeners, Lesley and I met approximately 18 minutes before we started recording. So I felt like this was such a, easy flowing conversation. I also love connecting with other people in the field as well. So I just appreciate you taking time out of your day on daylight savings, which we also
Yeah, we
talked
didn't
about
know how that was
before,
going
that
to
we
work.
didn't know how it was going to work out since we're in different
We're like, do
countries.
you
If
go back in time too? Wait, is it spring, fall back, spring
yeah,
ahead, right?
we both fell back. Luckily, it
Yeah,
all
luckily we
aligned. But
both did, and we got the time right. So
but this was wonderful. Just thank you so much for being here.
thank you for having me. I really appreciate it.
And
Thanks.
thank you, the listeners, for joining for today's episode of Psych Talk. And I will catch you in the next episode. Bye.
Bye.
Thank you for listening to today's episode of Psych Talk. Please rate, review, and subscribe to the show. And if you enjoyed today's episode, please share it with a friend. Don't forget to follow me on all socials at Jessica Lee, PhD, and the podcast at Psych Talk Podcast on Instagram.